Hello everyone, my name is Jagruti Golle, a final year B Pharmacy student from Shivaji Rao S. Zondre College of Pharmacy, Asangaon. I have prepared a presentation on anti-Parkinson drugs from the subject Pharmaceutical Chemistry under the guidance of our professor Manjusha Sanap ma'am. So let's start. First we will discuss the brief introduction of Parkinson disease. It is an extrapyramidal motor system disorder of nervous system characterized by the four cardiac features. Let's see that four cardiac features one by one. First is muscular rigidity. It increases the resistance to passive movement. It also includes cogwheel, jerky slew movements, etc. Bradykinesia. Bradykinesia means slowness and poverty of movements. It causes the loss of normal arm swing while walking. It also includes reduction in blinking of eyelids, loss of ability to swallow, and difficulty in initiating movement. Third is an impairment of postural balance leading to disturbance of gait and to falling. Fourth is resting tremor, which usually abates during the voluntary movement. Resting tremor commonly seen in hands and arms. This is pill rolling motion with the finger occurs most often at rate. It may also involve diaphragm, tongue, tips and jaw. Resting tremor increases with the stress. Parkinson disease is caused by degeneration of nigrostriatal system, which is dopamine secretion neurons of the substantia nigra that sends axons to basal ganglia. In this disorder, dopamine level decreases in the basal ganglia or nigrostriatal region of the brain. In the normal person, acetylcholine is equal to dopamine, but in Parkinson disorder, acetylcholine level is normal but level of dopamine is decreases. That's why acetylcholine show overactivity. Acetylcholine overactivity is also responsible for the synthesis of Parkinson. Let's discuss the diagnosis. It is difficult to diagnose Parkinson disease as there is no specific test for it. Doctors usually perform other tests in order to rule out after condition. Often seen in the dopaminergic neuron in the brain of patient who has Parkinson disease are Levy bodies, which are abnormal circular structure found within the cytoplasm. The Levy bodies have the dense protein are surrounded by the halo radiating fibers. Signs and symptoms. The main motor symptoms are collectively called Parkinsonism and Parkinson's syndrome. The symptoms generally come on slowly over time. The early symptoms of this disease are stoop posture, rigidity, flexed elbow and wrist, trembling of extremities, masked facial expression, forward tilt of trunk, reduced arm swinging, slightly flexed hips and knees, shuffling short step gait. The dementia becomes common in advanced stage of disease. Other symptoms include sensory sleep and emotional problem, etc. Pathophysiology. Parkinson disease is primarily associated with the gradual loss of cell in substantia nigra of the brain. This area is responsible for the production of dopamine. Dopamine is chemical messenger that transmits signals between the two regions of the brain to coordinate the activity. So the antipsychotic drugs, encephalitis and other causes, and it affects the substantia nigra. This destructs the dopamine producing neuron within the basal ganglia. It reduces the amount of available statal dopamine, which shows the inhibitory effect. There is increase in the acetylcholine, which shows excitatory effect. This excitatory activity of acetylcholine is inadequately balanced, and it causes the difficulty in controlling and initiating voluntary movements. Let's discuss the synthesis of dopamine. So the dopamine synthesis is restricted set of cell types, mainly neurons and cell in the medulla of adrenal gland. Here I have shown the outline of synthesis of dopamine. Let's discuss. Dopamine synthesis starts with the L-phenylalanine. This is converted to the L-tyrosine with the help of enzyme phenylalanine hydroxylase. L-tyrosine is converted to L-dopa with the help of enzyme tyrosine hydroxylase. This L-dopa is finally converted to dopamine with the help of aromatic amino acid decarboxylase. This is how the synthesis of dopamine is done. Now dopamine receptor. The effect and action of dopamine is done through their receptor, which are formed G protein coupled receptor type. Dopamine receptor divided into 5 subtypes, that is D1 to D5. They both have opposite effect regarding the CMP. D1 and D5 subtypes are members of D1 family. D2, D3, D4 subtypes are member of D2 family. When there is activation of D1 receptor, they stimulate formation of CMP neurons. When CMP increases in neuron, then it shows the excitatory movements. When there is D2 receptor activation occurs, they inhibit the CMP synthesis and suppress the calcium ions. It reduces the dopamine release. Now we will discuss the metabolism of dopamine. Here I have shown the outline of metabolism of dopamine. Let's discuss in brief. The dopamine metabolism occurs through enzymatic action of catechol O-methyl transferase and monoamine oxidase aldehyde dehydrogenase. There are two forms of monoamine oxidase, that is A and B. Dopamine is converted to the 3,4-dihydroxyphenyl acetic acid with the help of enzyme monoamine oxidase aldehyde and dehydrogenase. Then it is converted to the homovalenic acid with the help of enzyme catechol O-methyl transferase. Now, dopamine is converted to 3-methoxytyramine with the help of enzyme catechol O-methyl transferase. 3-methoxytyramine is converted to the homovalenic acid with the help of enzyme monoamine oxidase aldehyde dehydrogenase. Here we get the metabolite of dopamine, that is homovalenic acid. Classification of anti-Parkinson drugs. Anti-Parkinson drugs are classified into two main classes, that is drug affecting brain dopaminergic system and drugs affecting brain cholinergic system. So this is the classification of anti-Parkinson drugs. Now we will discuss the drug LEVODOPA. LEVODOPA comes under the classification dopamine precursor. This is the structure of LEVODOPA. The molecular formula of LEVODOPA is C9H11NO4. Chemical name 3,4-dihydroxyphenylalanine. IUPAC name 2S2-amino-3,3,4-dihydroxyphenyl propanoic acid. Brand names of LEVODOPA are Cinemat CR, Duodopa, Percopa, etc. LEVODOPA is standard treatment for Parkinson's disease is referred to as L-DOPA, its precursor of dopamine. LEVODOPA causes person's remaining dopaminergic neurons to produce and secrete more dopamine, counteracting the effect of Parkinson's disease. However, eventually the nigrostatial dopaminergic neurons in the brain drop to a low enough count where the symptoms of Parkinson's disease become worse. This is due to the short half-life of LEVODOPA in the body, typically about 1.5 to 2 hours. LEVODOPA also activated dopamine neurons in the mesolimbic or mesocortical system and produces side effects such as hallucinations and delusions. LEVODOPA is naturally occurring L-isomer of the amino acid dihydroxyphenylalanine with the same formula but a three-dimensionally different structure. To preserve the LEVODOPA for the brain by preventing the conversion of LEVODOPA to dopamine outside the brain, which may be associated with peripheral dopaminergic effect such as nausea and vomiting. LEVODOPA is prescribed with the peripheral dopa decarboxylase inhibitor. Now we will discuss the metabolism of LEVODOPA. LEVODOPA is either converted to dopamine by aromatic L-amino acid decarboxylase or O-methylate to 3,O-methyl-dopa by catechol O-methyl transferase. Once LEVODOPA is converted to dopamine, it is converted to the sulfated or glucuronidated metabolites, epinephrine or homovalenic acid through various metabolic processes. The primary metabolites are 3,4-dihydroxyphenyl acetic acid, about 13 to 47%, and homovalenic acid, 23 to 39%. This is the outline of metabolism of LEVODOPA. Mechanism of action. In the brain, LEVODOPA is taken up by the dopaminergic terminals in striatum and it is converted to dopamine by levoaromatic amino acid decarboxylase. Dopamine is as such cannot be used since it does not enter the brain. Levodopa is itself largely inert. Its effects depends on the increased synthesis of dopamine in the brain are mostly related to activation of D2 receptor. So the levodopa crosses blood-brain barrier and it converted to dopamine by levoaromatic amino acid decarboxylase, and this is produced dopamine is responsible for therapeutic effectiveness of the drug in Parkinson's disease. This is a synthesis of levodopa. I have shown the outline. Let's discuss in brief. Levodopa synthesized from the substituted cinnamic acid and react with the H2. The double bond goes to the single bond in this second structure. We can see that because of the hydrogenation. Then we add the H3O plus. Then we get the levodopa by the hydrolysis. This is how the synthesis of levodopa is done. Uses of the levodopa. Levodopa used to manage the Parkinson's syndrome such as tremor, stiffness, and slowness of movement. It is given in combination with carbidopa used to treat symptoms of Parkinson's disease. It is preferable to keep treatment with as low doses as possible and to use the dopamine against instead reduction of response fluctuation. Levodopa can be ameliorated all the clinical features of Parkinson. It is particularly effective in relieving bradykinesia and any disabilities resulting from it. The benefits of levodopa treatment often begins to diminish after about 3 to 4 hours of therapy. Precaution that should be taken during the levodopa therapy. During the levodopa therapy, patients should avoid protein diet or amino acid containing diet. Levodopa absorbed from intestine and amino acid transporter. Levodopa and amino acid compete for same transport for absorption, thus decreasing the levodopa absorption. Levodopa should not be taken with the vitamin B6, that is pyroxyl phosphate. Vitamin B6 decreases effectiveness of the levodopa. That's why vitamin B6 increases its metabolism by increasing the synthesis of levodopa decarboxylate metabolizing enzyme. Vitamin B6 is cofactor of dopa decarboxylase. Side effects and adverse effect of levodopa. Side effects are dry mouth, loss of appetite, diarrhea, dizziness, confusion, constipation. Adverse effects are anorexia, nausea and vomiting, tachycardia, arrhythmias, orthostatic hypotension. These are adverse effects come under the cardiovascular effect. Then mental disturbance, that is vivid dreams, delucinations and hallucination. On-off phenomena. On-off phenomena in the Parkinson's disease refer to a switch between the mobility and immobility in levodopa treated patients which occurs as an end of dose or wearing off, worsening of motor functions, or much less commonly as sudden and unpredictable motor fluctuation. Then hyperkinesia. Now we will discuss the another drug, that is carbidopa, which is peripheral decarboxylase inhibitors. This is the structure of carbidopa. Molecular formula is C10H14N2O4. Chemical name is N-amino alpha methyl 3-hydroxytyrosine monohydrate. IUPAC name is 2S3,3,4-dihydroxyphenyl 2-hydrazine 2-methyl propanoic acid. Brand name carbidopa, sold under the brand name Syndopa and Cinemate. Carbidopa is dopa decarboxylase inhibitor, so it prevents the conversion of levodopa to dopamine. It has no anti-Parkinson activity by itself, but it used commonly as its hydrate in the management of Parkinson's disease to reduce the peripheral adverse effect of levodopa. Its purpose to increase efficacy of levodopa by preventing its peripheral metabolic degradation and this allowing more levodopa to penetrate the brain. While dopamine decarboxylase exists both inside and outside the brain, carbidopa only blocks metabolism outside the brain cause it can't penetrate the brain. Carbidopa is always given in the combination with the levodopa. Metabolism of carbidopa. Carbidopa undergoes glucuronide conjugation metabolism. These metabolites of carbidopa are alpha-methyl 3,3-methoxy 4-hydroxyphenyl propanoic acid and alpha-methyl 4,3,4-dihydroxyphenyl propanoic acid. Let's discuss the mechanism of action. It inhibits the conversion of levodopa to dopamine in periphery. Carbidopa cannot cross the blood-brain barrier, so it inhibits only peripheral dopa decarboxylase. It does prevent the conversion of levodopa to dopamine peripherally. This reduces the side effect of causes by dopamine on the periphery as well as increasing the concentration of levodopa and dopamine in the brain. Let's discuss the synthesis of carbidopa. Here I have shown the outline of synthesis of carbidopa. Let's discuss in brief. The synthesis begins with the modified Straker reaction using the hydrazine and potassium cyanide on aryl acetone. This is then hydrolyzed with the cold HCl to give carboxamide. The vigorous hydrolysis with the 48 HBr, that is cleave the amide bond and aryl ether group to produce the carbidopa. This is how we synthesize the carbidopa. Combination of levodopa plus carbidopa. It has some advantages and disadvantages. Advantages are dose of levodopa is reduced to 1/4, less side effect like nausea, vomiting, tachycardia, on and off effect is minimized, enhance the efficacy. Disadvantages are chances of dyskinesia, postural hypotension is not resolved. Also chest pain, agranulocytosis, hypersensitivity reactions, etc. Side effects and adverse effects are blurred vision, dry mouth, difficulty in breathing, agitation, fatigue. Adverse effects are chest pain, agranulocytosis, hypersensitivity reaction, dyskinesia, postural hypotension. These are the references from where I got the information. First is Wilson and Giswold's textbooks of organic, medicinal and pharmaceutical chemistry. These are the links of PPTs. Acknowledgement. I am thankful to Dr. Shivajirao S. Zondre, our president, our secretary Dr. Geeta Khare ma'am, our principal Dr. Nitin Mohire sir. I hope you understand. Thank you so much.